Hello everyone, my name is Amy Wilhelm. I'm one of the school nurses in Baldwin County, and today I'm going to be talking to you about care for the students during transport. Our goals today are to review the emergency definition, review guidelines for standard precautions, review first aid overview, and review diabetic education. We're also going to review anaphylaxis preparedness program. What is an emergency? It's a serious, unexpected, and often dangerous situation requiring immediate action. It poses an immediate risk to health or life, and it requires immediate care from a qualified medical personnel. It could be shortness of breath, choking, uncontrolled bleeding, chest pain. What are we going to do in an emergency situation? Well, first of all, we will assess the situation. If you need to pull your bus over, you would pull your bus over, and we would call 911 for help. Go ahead and pull your first aid kit out, and we're going to begin with administering first aid until someone with more advanced training arrives. Standard precautions and blood-borne pathogens. Standard precautions are the method of infection control in which all human blood and certain body fluids are treated as if they are known to be infectious. Blood-borne pathogens are bacteria, viruses, or other microorganisms carried in the bloodstream which may cause certain diseases. Some examples of standard precautions that we could use are gloves, which is our frontline standard precaution. If not, you would want to use any other certain kind of barrier that you could provide between you and the student, such as gauze or Band-Aids or paper towels. Standard precautions do include, as I said, wearing gloves. So you should have some of those in your first aid kit on your bus, which I do recommend wearing anytime that you do first aid. If you have hand sanitizer, that's also part of standard precautions, or if you're able to wash your hands with soap and water. Anytime you could be exposed to blood or body fluids, make sure that you attempt to put some gloves on. If you are exposed to blood or body fluids, make sure you follow these steps. Stop what you're doing and wash the exposed area with soap and water or any kind of disinfectant wipe that you may have in your first aid kit. Report the incident to your principal, supervisor, or school nurse right away. And then you'll want to seek medical attention if needed. If you haven't been vaccinated for hepatitis B, ask your doctor about the hepatitis immunoglobulin. This is a treatment that can be given after an exposure has occurred. Basic first aid. Basic first aid is basically, we're just going to touch on it a little bit and talk about some of the main topics that you may see driving the bus. Basically, anytime that you do have to call 911 for an emergency, we do want you to know that you need to make sure you notify the parent that you're calling 911 and the building administrator so that they also are aware of the situation. Make sure you have any type of standard precautions that you can have, such as gloves or towels to protect yourself from somebody else's blood or body fluids. Okay, the first thing we're going to talk about is asthma. We do have quite a few kids on the bus that do have asthma. Usually you'll have their health care plan, and there'll be an order for them to have their inhaler, usually on person. What are the signs and symptoms that we're looking for? Those will be things such as wheezing, rapid breathing, tightness in the chest, coughing. They may have blueness around their mouth or their fingertips. They may not be able to talk, and you may see them using their accessory muscles, like their stomach muscles, to try and breathe. When they have things like that going on, you know that they're probably having an asthma attack. And the first thing you'll do is ask them to pull out their inhaler. And usually you can look on their health plan that you have. They'll give 2 puffs to themselves of their inhaler. And they usually give 1 puff, and if they wait a full minute and give the second puff, that medication is actually going to work better. So after the 2 puffs, it will actually take a few minutes for them to start breathing a little bit better. But if it does not, and you feel like things are not improving, go ahead and call 911 and parent if needed. Bleeding. To protect yourself from bleeding, obviously you'll always wear gloves when you can. You want to apply gauze dressing over a site that's bleeding. If you have gauze in your first aid kit, you'll get that out and just press some gauze down, and what you'll do is you'll hold pressure. And you want to hold pressure until the bleeding stops. If you feel like you need more gauze, like maybe it's bleeding through the wound, you'll go ahead, instead of removing what you have, get some more gauze and put it over top and just hold that down even harder. Sometimes if it's really badly bleeding, you can try elevating it above the heart, and that sometimes will help. There are situations where we may have to use a tourniquet to stop the bleeding if the bleeding is still bad after applying firm pressure. And what we can use is there's lots of different things that you could use between a belt, any kind of thing that you can wrap around, a shoestring, anything you can use to wrap around the extremity. And what you want to do is try to apply the tourniquet about 2 inches above where the wound would be. And you just have something that you can tie on there just loosely, and then you can get something as simple as a pen and just start turning it. And you want to start turning it until you see the bleeding stop. And then you would just leave that on and call 911 until they get there. Get it off. Okay. Bites, cuts, scratches, scrapes. Obviously, we're going to wash that area with soap and water or any kind of disinfectant wipe that we have. And we're going to cover the wound with a clean bandage that you have in your first aid kit. Gunshot wounds. This is something we hope never happens, but if it does, we need to be somewhat prepared to know what to do. If the student's conscious, you would clean and bandage the wound with what you have in your first aid kit to control bleeding, and that obviously would be what we just talked about, holding pressure. You know, if you need a tourniquet, you have to make a tourniquet out of something. We'll have the student lie down and elevate their feet 8 to 10 inches, and we'll cover them with a blanket because of the risk of them going into shock. We want to monitor them for loss of consciousness and difficulty breathing, and we would obviously start CPR if we need to, and make sure 911 is on their way. Fractures. We're going to have the student rest their injured part. I've got my folder right here. If it's their arm or certain parts, you can use basically anything that you have on the bus to kind of stabilize it. So you could use even just a notebook to kind of stabilize that that extremity until you're able to get help. So you would elevate it if you can, use something to support it. If you have some kind of cold pack or ice, apply that, and we would call 911. Seizures. This is something that we do see quite often on the bus. We do have a lot of kids that have seizures, so really get to know your kids and who have health plans and who have seizures on the bus. If you do notice a seizure, obviously you probably have to pull over. You could either lay them down into the aisle, or you could have them sitting and put something against the window so they're not hitting their head on the window. We want to note what time it is, and we want to try, if we can, to see how long that seizure lasts. We want to go ahead and call 911, and when this seizure subsides, go ahead and call the parent and let them know the situation. The paramedics can come and assess them. They do not always have to transport the student to the hospital when they have a seizure, but just make sure you do call and that they're assessed. And make sure you never put anything in their mouth while they're having a seizure. I'm going to go back for a second real quick and just say that lots of times when students do have a seizure, they do lose continence. So sometimes if they're having a seizure, if you could cover them with some kind of jacket that you have around, anything that's around that may save them from some embarrassment from the other kids in case they do become incontinent, that's usually pretty helpful. Okay. Head injury. If they do have some kind of head injury, I, as a school nurse, always make sure the parents know, because they may be all right at the time when it happens, but they may in 2 hours be acting a little bit different. So I always make sure I report that to the parent. If you have a chance, let the school nurse know too, so she can follow up on the next day. If you do notice some sort of bump on the head and you have a cold pack, I will go ahead and apply that. We want to make sure, like I said, the parent knows. We can keep them just resting. And if it's some kind of a neck injury, don't move them. Or if you suspect some kind of spine injury, don't move their neck. Just have them lay still and call 911. If they start to lose consciousness, their color's real funny, you notice them having a seizure right after they hit their head, any kind of neck pain, they're just acting not right, any kind of fluid coming from the ears, go ahead and call 911 because that could be a real serious head injury, could be signs of a concussion. And obviously we'll remain with the student until medical help arrives. Okay, burns. First degree burns only, we're just gonna flush the area with cool running water, cover with a cool wet cloth, and we're not gonna ever put ice on a burn. Second or third degree burns, this is when we have to call 911. Don't remove any pieces of clothing that are stuck to the burn. Cover the burn with a dry, non-adhesive dressing. Lots of times you'll have something that's called like a non-stick pad in your first aid kit, and you can put that on there, and it should be, it's usually in a little sterile package. And you can keep that on there until 911 call comes. Take any steps to prevent shock. We're going to lay the victim down flat and elevate their feet 8 to 12 inches. Try to maintain their normal body temperature, and that would be more if it's a severe third degree burn. Chemical burns, we're going to wear gloves and goggles if possible. Remove students' clothing and jewelry if exposed to a chemical. Rinse the chemical off their skin or eyes with large amount of water for 20 to 30 minutes. We'd contact poison control and 911 and probably the parent also. Heat exhaustion. I guess could be a possibility being on the bus. Sometimes they do get a little overheated, but signs and symptoms may be muscle twitching, cramps, confusion, anxiety, or loss of consciousness, chest pain, trouble breathing, dizziness, or convulsions. We'd want to get that person out of the heat. If you can get them in shade, that's the best scenario. Have them drink plenty of fluids, especially cool fluids. If you have cool sheets, you could cover them with that. And if it seems severe, you can call 911 if they don't seem like they're improving. Fainting, signs and symptoms obviously could be loss of color in their face. They could say that they feel dizzy or lightheaded, or feel real sleepy, pale, have some nausea or some sweaty skin. They may be getting ready to faint. So if they do, have them lay down, have them elevate their feet for a few minutes and see if they start to feel better. Sometimes just not eating for several hours can cause blood sugar to drop, and that can sometimes make them feel like they have to faint. So, if you have some type of sugar, you can even give them that. But just make sure that they are improving after they lay down and put their feet up. If not, and they seem like they're getting worse, don't hesitate to call 911. Choking. If they're eating something on the bus and they seem like they're choking, signs may be that they are grabbing their neck and saying, doing the universal sign of choking, saying that they can't breathe or looking like they can't breathe. Their skin may be changing colors. They probably cannot talk to you, and they have that very panicked look on your face. You may need to intervene. So obviously you pull the bus over, you get behind them, you make a fist, you put it between, right below the ribs and above the belly button behind them, and with their thumb push in and up until something either comes up or they pass out. And hopefully something's going to come up. If they were to go unconscious, obviously that's when we would start CPR. But if something does come up, we still need to go ahead and call 911 and have them assessed. Even if they seem like that something has come up and they're okay, we need to make sure that they have not aspirated anything into their lungs. Okay, diabetes. Anytime you have a diabetic, you should definitely know who they are, so you can kind of keep an eye on them. If their blood sugar is less than 70, we consider that a low blood sugar. And signs and symptoms may be that they're weak, shaky, confused, sweating, combative. Lots of times their color just doesn't look right, and they may not make sense to what they're saying. You may notice that slurred speech. And if you know they're diabetic, go ahead and have them take out their glucometer and tell them to check their blood sugar. And if it seems like it's below 70, then we know it's low. So if you have some kind of a packet, usually the school nurse will give you something with some snacks and quick-acting sugar in it. So go ahead and give them either some glucose tabs or a little bit of juice. And then we want to follow with something like with a protein and a carbohydrate in it, like some peanut butter crackers or cheese crackers, something that will help to get their blood sugar. Now, when you give them one of these things, usually it takes about 15 minutes for their blood sugar to come back up. So you want to have them recheck it in about 15 minutes. If they seem like they're getting worse and not responding, then I would call 911. Definitely, if they go to where they cannot swallow, you need to go ahead and call 911. You sometimes will have cake icing that we can use for real low blood sugars, and that's when they especially can't swallow. So that's something you could do. You could squirt some cake gel between their gums and their cheek and kind of massage it in. But that's something you would do only if they really couldn't swallow and you're waiting for 911 to come. That's something you could do to try to get their blood sugar up while you're waiting for 911. Okay. High blood sugar, which is hyperglycemia. It's when their blood sugar is over 300. This is not really an emergency, but if you do notice they're acting kind of strange and you think it might be a high blood sugar, you could always notify their parents or the school nurse and let them know. But signs and symptoms of a high blood sugar may be increased thirst, dry mouth, frequent urination, nausea, blurred vision, fruity breath. Usually they also have a headache, and they can be real irritable. Those are all signs of high blood sugar. And like I said, that's something that you don't need to treat right off the bat, but if you ever notice them just not acting right, you're not sure if it's high or low, always treat as a low blood sugar and go ahead and give them some kind of sugar. Anaphylaxis, a sudden allergic reaction to something, and you should know all of your children that have a health plan for anaphylaxis, and it may be peanuts they're allergic to, it may be bees, wasps. You see all sorts of things that they can be extremely allergic to. I think I even have a student at my school that's allergic to tomatoes and blueberries. So there's all kinds of things that they can be extremely allergic to. Usually those kids are going to have EpiPens that they, carry on them or have on the bus. And it's good to know which kids definitely have these kind of reactions, so you can watch out for them. Symptoms of a mild reaction would just be, they're itching a little bit, or they know that they've ingested a certain thing, but you don't really notice a lot of facial swelling or shortness of breath or anything. You just notice some minor symptoms. And what I would do is pull over and call the parent. And if it starts getting worse and you notice any shortness of breath, especially like facial swelling, like their tongue and their lips are swelling, they start throwing up after they've eaten a certain thing. They say they feel like their throat is closing up, or that they have to keep clearing their throat. Those can be all signs that it's a severe allergic reaction. So those are the things we really want to look for. If you notice any of those things, do not hesitate to call 911 and give this EpiPen. And this is one of our EpiPens that we usually have our kids that they will carry around. And all you need to do is pull off the blue safety cap on the back and hold it like this, and this will actually go through their pants. We're going to jab it. We're going to aim for that big muscle in the thigh. But all you need to do is you just hold it against the thigh, and you hold it for 10 seconds, and as soon as it comes out, you won't even see the needle. It's already gone. Make note of what time you gave it. And this is where you really need to review your kids' health plans, because some of these kids have 2 of these EpiPens. And if in 3 minutes they're still having symptoms, they don't feel better, then you can give the second one. So this is where you really need to review which of your kids have these, and do they have 1 or 2 pens, and get to know those kids. But 911 should be coming, and this will work really quickly, and they'll immediately start feeling better. Okay, and this is our second kind of EpiPen that we usually see. It's called an Avi-Q, but a lot of these kids have them, and they actually talk to themselves, and they will guide you and the child through giving the EpiPen. And these kids, they're trained to give them lots of times themselves, but you may just have to help them, because sometimes in the heat of the moment they get very flustered. So this one, you just pull off the cap.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
Okay.
This trainer may be reused.
So this one and this one are the exact same medication, just in different modes of transmission, but they are both equally effective, and just depending on what the doctor has ordered for them, they work the same. But make sure you always call 911 as soon as you give these. There's another picture of what the EpiPens look like. The green ones actually are juniors, so you'll see that more for the younger kids, and the yellow ones you'll see for some of the older kids. And we do have these stocked in every school also, but the ones that you'll be dealing with are usually the ones that the kids carry on the bus that they prescribe by their doctor. When you get back to your school, make sure you go to your nurse and get checked off. Every year we have to check you off, that you know how to use the EpiPen, and she'll have you check off in her office and have you demonstrate how to use it. And that is all for our presentation today.